Oh, hi. So if people wanted to get in touch with you for treatment, what, how can they get in touch with you? And do you have like websites or email address and other
Yeah,
protocols that people have to follow?
right. I have two websites. The first for truly the regenerative treatment and the stem cell treatment is northfloridastemcells.com. That's northfloridastemcells.com. And there's a contact form, and you can ask questions. You can leave your email. You can email us directly. Everybody in the office is well versed with answering questions. There's a phone number there. You can call us. We can answer all your questions. But it's very easy to set up an appointment with me. This is a big decision. I know what it's like to be a parent. So I call and talk to everybody on the phone when we're first starting to think about it, because there's questions they haven't thought about. There's questions they have thought about. There's people who think this is kind of a crazy treatment, and I can send them really scholarly papers on why it's being done. This is not a flash in the pan type treatment. There's good experimental evidence that it works. There's animal examples of autism that it works on, and now there's clinical trials that it's working on. But
And we've been doing this for about 3 years now.
right, and we have testimonials and remarkable stories, and so
And some kids who've come back for their second and third treatment because they've
Oh,
had so much success. We've had kids who are non-speaking and now they're speaking. We've had kids who, are doing amazing in school. We have a lot of success stories. It's an
all right.
amazing
So
journey.
is it like a continuous treatment, or is it?
Good question.
nobody knows. And so we know from the initial Duke study that kids tend to improve until 6 months, and then they plateau, but they never regress. And this correlates with how we think these cells work. These cells don't stay long-term in your body. They increase and work for about 6 months, and then they go away. So it may be you get treated every 6 months until you get to an area where your child is neurotypical. We don't know that yet, just because those studies haven't been done. But many families see so much improvement after one treatment, they're coming back for another in about 6 months.
Okay. And when you're talking about this treatment, what are the cost implications for parents? Do they have to be there in Florida physically?
Yes, well, the child has to come to us, and our nurses are very good. We'll meet with the family before we do it. We go over everything again. If the child needs sedation, we give them the sedation, but the child stays with the parents the whole time. We start an IV, and then the cells are just given through the IV, very quickly. But everybody in the office is set up to do this. It's a gentle, kind area, and we want to make it as easy as possible. However, it does cost money, and the money is not cheap. And we treat based on the weight of the child. So the older the child, the heavier the child, the more cells they need. And this was demonstrated at the Duke study, where if you were below a certain threshold, there was no benefit seen. And so that threshold is about 1 to 2 million cells per kilogram. And so they go by vials, but each one vial would be like $4,500, 2 vials, $8,500, 3 vials, $12,500. And this product is expensive for a variety of reasons. And first and foremost, when a child is born, the cord and the cord blood gets rushed to the lab. It has to be there within 48 hours. And so all that's processed. And in the meantime, they're doing genetic screening on the mother, genetic screening on the father, and then blood work on the mother, to make sure there's no HIV or hepatitis or Zika virus, all the different, viruses out there in the world that could be transmitted. It takes about anywhere from 4 to 5 weeks to get all that data back. And the data is very stringent. There's data on you can't have a tattoo within the last 6 months. you can't have traveled in 6 months. You can't live out of this country for 6 months. And so probably 8 out of every 10 get discarded. So the company has invested the time and the energy in getting the product prepared, only to throw it away. And so that drives up the cost a little bit.
All
And
right.
plus, there's a lot of people.
Did you say they can't live outside the country for less than 6 months?
No, I meant to say they can't have traveled outside of the country within 6 months, because the FDA is concerned of picking up a viral illness that's not, currently seen in the United States, such as, from Ebola to Zika to other diseases.
All right. Okay.
Dengue fever, people go to the Caribbean.
The mother who's donating the cord.
Right. And then the genetics of the family trees, both parents and grandparents, gets looked at, and other siblings actually as well.
Okay. And when you're talking about this genetics, does the umbilical cord blood used have to have the same genes or DNA as the child that is being treated?
That's a great question. And the answer is no. These cells are so new. They don't have these special proteins on their outside that are called the self proteins, something called HLA proteins. Like if you get a liver transplant or a heart transplant or a kidney transplant, it has to be matched to you so you don't reject it. Well, these cells don't have those proteins on them. So they're kind of generic cells. They can be given to anybody.
All right. And when you say it's just generic cells, so why is it that the parents have to be screened?
Because there's certain things that can be contained in the blood that can be transmitted. Plus,
No, but I mean, if it's a child that is already out of the womb that is being treated, so why is it that parents still get screened?
oh, because with a vaginal birth, there's sometimes mixing of the blood as you pass through the vagina, and so that's why there can be a maternal transmission of AIDS and hepatitis to the child, and so that's the big problem. Now, have you ever heard of RhoGAM? It's a very common treatment they give pregnant women, because if a pregnant woman is Rh negative, which is a factor in the blood, and they give birth to a child who's Rh positive, and there's mixture at birth, then the mother can develop antibodies against that factor. And if she ever gets pregnant again and has a child with that type of blood, the fetus can be attacked. So yeah, there is a maternal fetal mix of blood at birth.
Okay. Thank you so much for clarifying that. I still have another question going from there. So how do you then source for your umbilical cord blood that you actually use in the treatment?
I get it from a company called LeoCorps, which is a leader in biologics, and they get the products from live healthy births throughout the United States. There's a donor network. I don't know, earlier, probably 10 or 15 years ago, people heard of bone marrow transplants.
Yeah.
A child had leukemia, you needed to give a bone marrow. Everybody was looking to see if their bone marrow matched. Well, that's really not done anymore, because doctors have figured out a way to completely remake an immune system through umbilical cord blood. And 6 out of every 7 children with leukemia doesn't have a donor in the family. And so they need this blood. And like I said, this blood is used for over 80 different diseases. And so as soon as you donate, it may not go to a child with autism. It may go to a child with leukemia, lymphoma, or any of these other diseases.
Yeah, I was just going to come to that. We are talking about autism right now, but as you just said, the same treatment, the same fetus, the same umbilical cord blood can be used to treat other ailments. What other ailments have you actually noticed or experienced that this umbilical cord blood works for?
I've treated people with pulmonary fibrosis, a disease called sarcoid, and their certain lung, measurements have increased, by 25%, but usually it's a downward spiral and they need lung transplant. Multiple sclerosis I've treated. I'm getting ready to treat Parkinson's, but kind of the big adult neurodegenerative disorders such as Alzheimer's, Parkinson's disease, ALS, multiple sclerosis, chronic traumatic encephalopathy, traumatic brain injury, spinal cord injury. All of these diseases are now being tested, and it looks like there's going to be significant benefit with this same type of treatment, because at their core, they all have neuroinflammation.
Thank you so much. And so the last bit that I want to talk about is the actual procedure for the treatment. So could you enlighten us about that?
Yeah, it's really a lot easier than I thought it was going to be. So when I took my son, obviously he was older and he had an IV before, so he wasn't nervous about it. It was very easy. They just put an IV in him. They gave him some IV fluid and they put the cells in the IV bag, or they pushed him through, and it took about, I don't know, 10 minutes.
Yeah,
and he was done. And
wow.
It was kind of anticlimactic because I didn't know. I was in my mind thought it was a different thing, and for him personally, it happened right away. He slept a lot that night, probably over 10 hours, and the next morning we saw
changes,
significant changes. He had conversations with us at breakfast that I was crying because I was like, who is this person talking to me right now? It changed, it changed him immediately. But we in our office we have kids who are much younger, and they're
scared.
They're scared. And like I said, our office is babysat my son, so they know autism, and they know they're very kind and gentle, and they know how to treat the kids that come in. They're not afraid of anything. They're just warm. It's a warm, comfortable office because of the experiences they've had with our family.
And I think as a surgeon, I put people to sleep all the time, 4 days a week. And so to me, it's very easy. It's less traumatic, on the parents, the child, and obviously the staff, if we can give them a quick sedative and they become sedate and they just kind of lie down and hold their arm out. We can usually get the IV in-out treatment done, before the child wakes up, and they're usually kind of sedate for about 30 minutes, 35 minutes. We always leave the IV in, longer than it takes, so we can watch them, make sure everything is good. Side effects are very rare. 2 to 3% of children have a little rash or a little fever. And we usually pre-treat with a little Benadryl or something to help prevent that. But the product's very safe. It has the ability to help, and it can change lives.
Oh, thank you so much. Has been talked about now within this podcast, and we just want to continue raising this awareness. I know because a lot of people still don't know about this treatment, and it's something that could be so life-changing. So why is it still that people and this kind of information is not widespread? I mean, we had COVID and the whole world was shut down, but autism and neurodivergent disorders are becoming widespread and nobody's talking about them.
Oh, I agree.
That is a great question.
I think this is worse than COVID, because, you know, and not to minimize COVID,
Yeah.
but, you know, when any new disease hits the world, you know, the people that are affected the most are the weakest. And so the people that were affected by COVID were the old, the infirm. But this strikes at children, at babies, and they live a poor life their entire life. And so I think the world should shut down. I do. I think we should focus, you know, there should be a task force looking at autism like happened with AIDS, you know, because this is potentially, you know, altering the course of humanity, and we have to figure out what's going on, and you know, not only how to treat it, but what's causing it.
Exactly. Because I think once we know the cause, maybe we could fix that and reduce
Correct.
these rates. Yeah.
Right. And it affects boys, you know, more than it affects girls.
4-to-1.
And you think, you know, that will affect so many things, because all these boys are wiped out of society. They're not going to, you know, get married. They're not going to have children. They're not, you know, you think that's going to affect what happens generations from now.
Yeah. Oh, so, and I mean, I just going back to something you mentioned earlier, that your son was actually rejected because they said it was too old for the treatment. And if I'm thinking right now, could he have had a better quality of life if he had had access to this treatment earlier in life? Because I mean, there's so many things that he's missed out on right now. And
Well,
I think so.
yeah, well, it makes sense that the sooner you get better, the more your brain, you know, works and grows and things like that. But, you know, you have to remember he was, you know, already in his 20s when this was discovered. So he was born in 95. It was scored in 2019, you know, is when the first paper really came out. So he was already in his 20s. And so he didn't have the opportunity. You know, you don't know what you don't know. And so, but we're glad it happened.
But do we wish he was 4?
Yeah, without a doubt.
Absolutely wish he was 4. It would have changed the dynamics of our family if he,
And his trajectory in school and everything else.
right, it would have changed school for him. It would have changed our relationships with our other, you know, children. It would have changed a million things.
Yeah. And then, I mean, talk about the schools. I mean, the fact is right now, children with special needs have less chances of going to school, especially in England. I mean, it's like a postcode lottery thing here to get a child with special needs to have a place in primary school, even in nursery schools. And government specifies that they have to go to these special schools, but then there's no place for them.
Right.
So how do we go? I mean, how do we balance that? It's difficult.
And it's only growing. I mean, every year autism is getting more and more and more common, and none of the schools are accommodating this. I mean, it's horrible. Yeah, I mean, I don't know how that's going to happen unless you homeschool, which is even harder to do.
Or you can't because you're working.
Yeah. Oh, all right. And from your experiments you have carried out, is there any reason why there has been like this surge in these cases of autism?
Well, nobody knows why autism is increasing, you know, but I think, like we talked before, that now that we know it's an inflammatory disorder, our lifestyle has been increasingly inflammatory in nature, from the foods we eat, you know, the more processed foods you eat, obesity and overweight is a tremendous problem. the potential vaccines,
I mean, we
Or-
went,
or-
yeah, with vaccines, we went from,
4 or 5
I
to,
think what we had when we were growing up, maybe 4 or 5 to 72 vaccines now.
I know.
I mean, that's,
And those
do we
vaccines that
really need all those?
do,
Should there be a customized, way to give them, farther out? Should we take the aluminum out? Yes.
exactly.
I mean, there's a lot of, that's not our, that's not our genre. We're not in that. We're in
the treatment.
the treatment because we can't change that. We can't
Mm.
change the vaccine schedule. We can't
Yeah.
change. We're trying to treat what we have so far.
Yeah.
But it makes, it makes sense. There's just not good vaccine science. There just isn't, no good or any randomized, placebo-controlled studies. In the United States, there's about 3 million kids who have never been vaccinated. It would just be interesting to look at their health profile versus everybody else's health profile,
Yeah.
and that is not being done.
Well, they know in the Amish community, which does not get vaccinated, that there's no
Very
sign,
rare, yeah.
no signs of autism in the
Yeah.
Amish community, which, why not study that?
Exactly. Oh,
Right.
thank you so much for the insights that you've shared today. And I really appreciate everything you've disclosed and talked about today. But is there any recommendations that you have for people living with autism right now, and for parents as well who have to deal with the children who have autism, either they are grown up or whether they are like, because right from childhood, you would know that something is definitely wrong with a kid. And sometimes, like I said before, parents deny that it is autism or it is ADHD or it is something else. So what can you advise? What advice can you give to them?
Well, I think the book kind of tells everything that we did and we thought that would help. But first you have to get over denial, and you have to treat, your child like your child. And you have to kind of, what we did is, what are his strengths? What are his weaknesses? How do we try to impact on his weaknesses? Does he need speech therapy? Does he need occupational therapy? Does he, behavioral therapy? Because this can lead to changes. What's available in the community? Where's he going to go to school? How's he going to go to school? What's he going to do after school? All that stuff. You just have to make a list and start chipping away at it.
I would try to model my child up. It's kind of, I always think like when you play tennis, you want to play tennis against someone who's better than you, so you get better. Well, I tried to model my child up. I tried to find, groups that had children that he could emulate, that he could, have an example of. And so, you try to put him in activities where he's going to have success in those small little venues. That was what I did. Everybody has to, do their own thing and figure it out. But I think like you said, the book shows, I have a chapter at the end of the book that shows the things that I did, and you can just now go online and look and see, is this something that, is something that could affect my child positively? Let me look into this. There's a website called Autism Navigator that you can go on, and you can upload videos of your child, and they will diagnose your child, and they will give you pointers of how to help your child for free.
No.
Autismnavigator.com.
Yeah, Dr. Weathersby from our medical school, she's a leader in early diagnosis and a real autism pioneer. And so she's developed this where especially people who are in rural areas or people who don't have access, you can upload, tell them the history, upload videos, and get real practical advice from experts on what you can do. I think that's a tremendous benefit.
Oh, thank you so much, and I'm so grateful. And just on a last note, do you have any last words for anyone?
Don't
Just
give
now?
up. Don't give up. Keep going. Keep working.
Yeah, the knowledge is exploding in this area, and it's a tough life. It's difficult, but say your prayers at night, keep on every day, and hopefully your child can get better.
Oh, thank you so much. I am so grateful, and we hope to speak to you again soon. And I'll probably be sending referrals to you. If I send people and they mention my podcast, do you have any kind of maybe discount for them? A discount code?
No, I try to keep this as cheap as possible, because right now my surgical practice is kind of paying all the overhead. It pays for my building, it pays for my nurses, it pays for everything. And so I had to hire a couple people to do this, and the cells are exquisitely expensive. So I'm trying to make this available to as many people as I can, because I don't have to make money doing this. I just have to not lose money doing this.
That's so nice of you. I mean, thinking you don't have to make money, but
No.
you don't have to lose money. Yes, I mean, if people thought like that, the world would be a better place.
Right. Well, at something,
But I think you need to make money still anyway.
Yeah. Right. Exactly.
Yeah.
Well, thank you for
Inviting us.
spreading the word, and you're a light for people who are looking for information, and we thank you for being out there. Without you, people wouldn't find us. So thank you for
Yeah,
I'm so grateful. I mean, it's just life is full of so many up and downs, and we just want to try and make things better. If they can find information in a way by listening to our podcast, then that's good. That's a good thing, So that's why I do this podcast. I mean, it was something I started as a lockdown project, and it's still going.
Right.
Thank you so much, and
Thank you
have a
so much.
lovely Easter weekend.
Yeah,
You
you
too.
too. Happy Easter.
Happy Easter.
Thank you.
Thank
Bye-bye.
you. Bye now. Bye.
Bye.